It is those values that underpin the Rehabilitation Act and the values that will propel us forward to fully achieve the promise of a nation that provides equal access to all. The Biden-Harris administration is committed towards achieving that promise. Earlier this year, the Department of Housing and Urban Development issued a Section 504 advance notice of proposed rulemaking, acknowledging the need to align HUD Section 504 regulation with environmental, societal, and technological advances and emerging issues. Today, the Biden-Harris administration is taking further action on its commitment to promote access to healthcare and human services for persons with disabilities. Our first presenter is Melanie Fontes-Rayner. She serves as Director of the Office for Civil Rights at the U.S. Department of Health and Human Services, where she leads the department's enforcement of federal civil rights and privacy laws and directs related policy and strategic initiatives. Previously, Melanie served as counselor to Secretary Javier Becerra, providing strategy and guidance to the Secretary on issues pertaining to civil rights, patient privacy, reproductive health, the Affordable Care Act, competition in healthcare, equity, and the private insurance market. In this role, she has led the implementation of the bipartisan No Surprises Act, helping to increase transparency in medical billing and save consumers money. She also served as the Secretary's designee on the White House Competition Council, leading cross-cutting department work and a whole-of-government approach on price transparency, costs, and competition to benefit American consumers. And before joining the administration, she served as Special Assistant to the Attorney General and Chief Healthcare Advisor at the California Department of Justice, where she led a national team to save the Affordable Care Act and protect healthcare coverage for over 133 million Americans. During this time, she facilitated the creation of a new office, the Healthcare Rights and Access Office, devoted to proactively advancing laws pertaining to healthcare, civil rights, privacy, competition, and consumer protection. Melanie worked on multiple groundbreaking settlements, such as the $575 million historic settlement against one of the largest healthcare systems in California to increase competition and consumer choice in state and multiple bipartisan settlements to address the national opioid epidemic. She is a true powerhouse, and we are so lucky to have her today to speak about her historic announcement today. So with that, I'm going to turn it over to Melanie.
Thank you, Anna. So thank you, everybody. We're very excited to be here with you today to talk about this significant milestone by the Biden-Harris administration in announcing a new proposed rule under Section 504 of the Rehabilitation Act. Section 504 prohibits discrimination based on disability and covers both programs funded by the Department of Health and Human Services, as well as those programs conducted by the department. My office, the Office for Civil Rights, is aware that significant discrimination against persons with disabilities continues and persists in this nation through healthcare and human services. And as a law enforcement agency, we've received reports of discriminatory practices from researchers, advocates, and from persons with disabilities themselves, letting us know about the real world impacts they face daily. Some of my regions have people that call every day, month, week, because the only way that they're able to get their provider to provide them with an accommodation is to have the Office for Civil Rights call on their behalf. This shouldn't be this way. We can do better. This input from our law enforcement experience, this input from people across the country, from countless advocates on this Zoom at the event with the Secretary earlier today, has led to us being able to provide this new reg today, a review of the existing regulations and updating those regulations. Today, we announced these much updated needs to strengthen and advance protections for persons with disabilities, and significantly a proposed rule that reflects the input and priorities of this community. This is a key achievement for President Biden, and under my leadership and that of Secretary Becerra, we're really excited to advance equity and civil rights. As you all know, We had peaceful protests around the country, including here at the Hubert Humphrey Building in Washington, D.C. So it's significant to have a president and a secretary who didn't have to be forced to sign regs, who were prospectively working to create and strengthen the existing regulations. There's been a lot that's changed over the time, and so these regs take steps to improve that and ensure that. So a couple of the areas I'll talk at a high level, and Molly Burgdorf from my team will talk more in depth. So one, the rule ensures that decisions about medical treatment are not based on biases or stereotypes. Again, we oftentimes see this happen, especially during COVID-19, where discriminatory standards were used to determine who received life-saving care, such as a ventilator. We have enforcement work, we put out policy on this. This rule takes it a step further and makes it very clear this is not lawful. Second, for the first time, this rule implements a standard to ensure non-discrimination in the use of technologies that are routinely used in healthcare, including web content, mobile apps, and kiosks. For any of us that have been to an emergency room or a lab lately, you know these technologies are widespread. They're used to check you in, they're used to set up appointments, they're used to deliver healthcare. And so this is for the first time we're implementing a standard that we can enforce to ensure that these technologies are accessible for persons with disabilities. We established a standard for accessible medical equipment that will be enforceable under the law. Too many people are unable to access effective medical care, including preventative care and early diagnostics, such as mammograms or pap smears. And for many people, this rule will mean that both providers are having those accessible equipments, and for the first time, they'll be able to receive them. The rule prohibits the discriminatory use of methods and analytics that place a lower value on the life of a person with disability, clarifies that prohibitions on discrimination on the basis of disability apply to child welfare programs. Again, this is something we see constantly in our enforcement. Just last month, my office settled with a state that improperly denied an individual the opportunity to apply to be a foster parent because she receives medication for treatment of a substance use disorder. This rule would aim to eliminate that and make very clear that both children who have disabilities and parents who have disabilities have rights, and they shouldn't be removed from homes just based on the basis of disability. And last, the rule clarifies that recipients must provide services in the most integrated setting appropriate to the needs of individuals with disabilities. Again, people with disabilities have a right to live and receive services in the most integrated setting possible, to live in their homes and communities instead of in institutions. This proposed rule makes sure that those programs and activities that HHS funds allow people with disabilities to receive needed services in homes and communities they choose. This proposed rule will be open for 60 days. It's on display today and will be up in the Federal Register on the 14th of September. We encourage the public to comment and look forward to working with you on such an important rule. And as a reminder, just because we have a proposed rule doesn't mean you don't continue to have rights. So if you suspect you've been subject to discrimination on the basis of your disability or your age, your sex, your race, we encourage you to reach out to our office because you continue to have those rights and we continue to enforce them. So again, thank you very much.
Thank you, Melanie. Greatly appreciate you. And our next speaker is someone that I've had the privilege to work with. I am so excited for all of you to hear from Alison Barkoff. Alison Barkoff was sworn in as Principal Deputy Administrator of the Administration for Community Living on day one of this administration. She is currently performing the duties of the ACL Administrator and the Assistant Secretary for Aging. She provides executive leadership and coordination for ACL's programs nationwide and advises the HHS Secretary on issues affecting people with disabilities and older adults. A sibling of an adult brother with developmental disabilities and a civil rights attorney, Alison is a lifelong advocate for community living, both professionally and personally, and has been at the forefront of national efforts to expand the home and community-based services that make community living possible. As a part of countless coalitions of people with disabilities, older adults, and advocates, Alison has fought to uphold the rights of people with disabilities and older adults and advance policies to ensure their access to healthcare, housing, employment, education, and all facets of community life. She has testified before Congress and the U.S. Commission on Civil Rights on Disability Rights and Community Living. She has served in a variety of leadership roles with disability rights organizations, including leading advocacy efforts at the Center for Public Representation and the Bazelon Center for Mental Health Law. She is a veteran of the federal government as a special counsel for Olmstead enforcement in the Civil Rights Division of the Department of Justice. She led efforts to enforce the rights of people with disabilities to live, work, and fully participate in their communities. She also led interagency initiatives at the Centers for Medicare and Medicaid Services on Medicaid HCBS and with the Department of Labor on direct care workforce issues. Alison is a leader, and again, we are so lucky to have her voice and input and advocacy, and I can't wait for you to hear from Alison. Alison, take it away.
Thank you, Anna. And let me give a brief visual description. I'm a middle-aged white woman with curly brown hair in a purple dress with a blue ACL background. And Anna, thank you so much for pulling together today's call. I just want to give a few brief remarks and then really want to make sure people have the opportunity to hear from Molly about some more details. I want to just emphasize what Melanie just said, which is today's announcement is a huge and major achievement for the disability community. You know, almost every disabled person can talk about the kind of discrimination and lack of access that they experience almost on a nearly daily basis in our healthcare and human services systems. But COVID-19 showed us and shone a spotlight on truly the catastrophic consequences when we have discrimination and inaccessibility and bias and stereotypes in our healthcare and human services. Whether it was disabled people being put at the back of the line when we were trying to get ventilators and ventilators were in short supply, or people who were unable to access services and supports that they needed to stay in their own homes and communities, and they were forced into nursing homes where COVID was rampant. But COVID created an urgency and a momentum for change. And the one thing I want to say to everyone on this call is this rule happened because of you. From the first days of the Biden-Harris administration, you made clear that updating these regulations was a top priority, a must do. And truly, as Melanie just explained, and you'll hear from Molly, these regulations are comprehensive. I know when you read this proposed rule and preamble, you will see your fingerprints all over it. It reflects the issues and concerns that you as a community have raised and the priorities that you have said to us we need to address. As Melanie mentioned, your input is critical. There is a fact sheet that OCR put out and ACL is just now putting out a blog, and both of those can help people understand what is in the rule and how to provide input. In addition, OCR and ACL will jointly be holding a stakeholder call on Monday, September 11th at 1 p.m. to walk people through in even more detail what is in the regulation. All of these materials are available online at acl.gov/504rule, and you can get everything about the rule there, including registering for this call. I'll just mention that because Anna pulls together both the disability and aging communities for these calls, it is critical to underscore that this rule covers people with disabilities of all ages. And many older adults do meet the definition of disability and are protected by 504, even if they might not think of themselves in that way. So I will just end by saying thank you to all of you in the community for your advocacy, for your partnership, and in advance for your input. I'll turn it back to Anna now to turn it over to Molly to explain more what's in the rule. Thanks, Anna.
Thank you so much, Alison, and thank you again for your incredible passion and leadership that has been instrumental in getting this over the finish line. It is my honor to introduce Molly Burgdorf. Molly is currently Section Chief in the Policy Division of the Office for Civil Rights at the U.S. Department of Health and Human Services. She is an advocate attorney, a woman with a disability. She has served as the Senior Director of Rights Policy with the ARC of the United States, the Senior Policy Attorney at the Center for Public Representation, Senior Advisor with the Administration for Community Living, and the Administration on Intellectual and Developmental Disabilities at the Administration for Community Living, among other roles. So we are really excited and honored to have Molly, show us and explain a little bit more about what this rule is, what's in the rule, and how to provide comments. Molly, take it away.
Thank you. Good afternoon, everyone. Just for my visual description, I'm a white woman wearing a black jacket, a dark blue dress underneath, with dark hair with some silver streaks in the front. And I'm going to walk you through some of the key provisions clarifying non-discrimination requirements in this proposed rule. Of course, we won't be able to cover everything in this call alone, so I encourage you, if you want more information, to sign up for the briefing that we're conducting on Monday, the 11th, that Alison mentioned, to get more details. But let me just take the opportunity to run through some of what we see are, again, the most important critical areas that the proposed rule covers. And these, as have been stated, were identified based on complaints that we received in our office, based on listening sessions with different communities, based on updates to case law, and based on research that we've looked at as we considered what we needed to do. So we absolutely rely on you to tell us what works, tell us what goes too far, what doesn't go far enough. The rule, as we mentioned, will be officially published on the Federal Register on September 14th. So a week from today, that's when comments will open. So you have a week to delve into it and get familiar. So I'm going to start with discrimination in medical treatment. This is proposed section 84.56. The proposed rule prohibits discrimination in medical treatment decisions, including decisions based on stereotypes about a disability or beliefs that the life of an individual with a disability has less value than the life of a person without a disability. And you'll read in the preamble, which is the discussion of why we are regulating in this way before the actual reg text, that this was in part an outgrowth because of the discrimination that became apparent during the COVID public health emergency. And we specifically discuss rationing of care in the crisis standards of care plans, in organ transplant decisions, and life-sustaining care. The proposed provision on medical treatment says that you cannot deny or limit clinically appropriate treatment where it would be offered to a person without a disability in similar circumstances. You also can't provide medical treatment to a person with a disability when you wouldn't provide the treatment to an able-bodied person in the same situation. So you can't impose treatment only on people with disabilities on the basis of their disability. And then I do want to flag, there's language about professional judgment in treatment. We work closely with our departmental partners to allow medical providers to exercise their professional judgment in medical treatment decisions while prohibiting the use of discriminatory factors. So please take a close look and comment if we got the balance right. Secondly, I wanted to mention value assessment methods. This is proposed section 84.57, and value assessment methods, what we're talking about, these are measures that can play an important role in determining whether a particular intervention, for example, a medicine or a treatment, will be provided and under what circumstances. And what the proposed rule says is that value assessment methods may discriminate against people with disabilities by assigning a lower value to extending the lives of a person with a disability compared with extending the life of people without disabilities. We prohibit recipients of HHS funding from using methodologies that would discount the value of a life extension on the basis of disability when providing or withdrawing benefits or services. A mouthful. We're trying to make sure that when the various measures are used to make these types of decisions, that they aren't assigning a lower value to extending the life of people with disabilities compared with extending the life of a person without a disability. And I do have to note, we are prohibiting the discriminatory use of a measure by a recipient. We are not banning any particular measures themselves. So again, take a look, see what you think. We look forward to your input. Next, child welfare. It's proposed section 84.60. And while there are existing prohibitions on discrimination in all of our programs and activities, this was an area where OCR felt like we needed more specifics. And so we include them. So the proposed rule would ensure that parents, children, and other qualified individuals are not discriminated against based on disability in child welfare services. And there's a number of specific prohibitions and clarifications about when a recipient may not discriminate in the child welfare context, including reunification and other services provided by child welfare systems. So please take a close look, and we welcome your input. Next, I want to discuss, so we have a couple of provisions where for the first time, HHS is adopting enforceable standards for accessibility. So accessibility of our programs and activities, again, is required currently, and you can submit complaints as our director has shared. But we are for the first time now adopting a specific standard so that recipients know specifically what they have to comply with, which will be web content accessibility guidelines 2.1 for web content and mobile apps. And we will also have a general provision for non-discrimination around the use of kiosks, because we know that's been a particular barrier to successful delivery of health and human services programs and activities to people with disabilities. I'm just doing a little time check here. The next new standard that we are adopting relates to accessible medical equipment. And that has a fairly involved bunch of proposed provisions. So it's a new subpart J in the proposed rule. And it includes a number of requirements. That means that barriers such as exam tables that aren't height adjustable, mammography machines that require a patient to stand, and weight scales that don't accommodate people with disabilities cannot be a barrier for people with disabilities from receiving effective and equal levels of care. So the proposed rule is requiring recipients to adhere to accessibility standards that the Access Board created for medical diagnostic equipment. And there will be phase-ins, as the director flagged in her remarks at the press conference, if you were lucky enough to be a part of that. There are different phase-in time periods and for different types of equipment, although for most doctors' offices or healthcare providers who use them, they will be required within 2 years to have at least one accessible weight scale and at least one accessible medical diagnostic equipment exam table. So we definitely welcome input about how much we need to do, how much further we may need to go, if this is too far. This is the opportunity for the agency to hear from you. And I know I'm repeating that again and again, but if you have one takeaway from what I'm saying here, it would be please comment. And then finally, the last specific provision I'm going to talk about is integration. So the current 504 regulation includes an integration mandate for services to be provided in the most integrated setting appropriate to the person's needs. But what we're doing here is incorporating principles established with the Supreme Court's decision in Olmstead and other significant court decisions. So essentially incorporating the case law that we rely on to interpret the current regulation and the current statutes, as well as some of the details from Department of Justice guidance on these issues, so that recipients understand exactly what they're required to do, and so that people with disabilities can understand the rights that they have in this area. And that'll be, you can find it in proposed section 84.76. And I think at that point, I will conclude my remarks and say we look forward to hearing from you. We hope you can join us on Monday to dig into some additional details and hear some examples of kind of the provisions that I just discussed. What are we actually talking about in real world terms? What will be prohibited? Thank you for the opportunity.
Thank you so much. I mean, for that amazing breakdown and, high level, very, quick overview about what is in this historic proposed rule. And as Alison mentioned, on Monday, September 11th, at 1 p.m. Eastern time, The Office for Civil Rights will walk through key provisions of the proposed rule in a webinar hosted by the Administration for Community Living. The webinar will be recorded and ASL and CART will be provided. Advanced registration is required. So if you are a community leader, if you are someone, who has had these experiences of discrimination or barriers, we want to hear from you. So where can you register? Where can you find these fact sheets that are also available in different languages? As Alison mentioned, visit acl.gov/504 rule. There you can find the links to register for the stakeholder call on September 11th, where there will be an even more detailed presentation about what is in the rule. And you can find the links to the fact sheets that are available in multiple languages. Again, thank you so much to Melanie, Alison, and Molly, and also to your incredible staff who were instrumental in developing this proposed rule. Thank you especially to all of the disability leaders who have advocated, for decades and really partnered with us to make today possible. So with that, we will conclude this webinar. We will send additional information. Again, thank you again for all your advocacy. And thank you to our interpreter and captioner. Have a wonderful day.